Day celebration. So the very first event we have is our SK Sen Sir's debate competition. Okay. Yeah. So Dr. SK Sen, born in 1910, was the very well-renowned surgeon of our country. He was the founding member of Delhi Surgical Society and past president of Delhi Medical Association for the year 1951 and 52. So, for our judges, we have Dr. Vipul Jain, who is a senior pediatrician, Dr. Seema Patni, past president Delhi Medical Association, DNZ, Dr. Ramesh Datta, past president Delhi Medical Association, Dr. Rajiv Sinha, vice president Delhi Medical Association, Dr. VK Kamath, former DGHS Delhi government. So now to start off the thing, we'd like to call Dr. Ashwini Dalmia to say a few words. President Delhi Medical Association.
Good evening. I think there is not much to say. We can see so many young faces. It's time to listen to all of you. Thank you. Thanks for coming and hoping for a fruitful debate today. Thank you.
So instructions for the debate. Each college will send two representatives, one for the motion, one against the motion. Each speaker will be given 5 minutes. You will hear one warning bell after 4 minutes 50 seconds and one full one for at the 5-minute count. You will get 2 minutes to do the question answer round, and the trophy and award will be given during the felicitation later on, right? And do collect your participation certificates later as well. So. I'd like to call our first candidate. Then it's fine either way. Even if you have one participant, that also will be taken care. So we'll start off with Maulana Azad Medical College. Dr. Niharika, please come on stage. She'll be speaking for the motion, and our topic for today is technology as our clinical applications. Aji. Yeah, wait. Niharika is coming. Acha. Dr. Niharika? Acha, here, aa koi nahi, advance mein kar. She's for the motion. Yeah. Excuse me.
Yes, sir.
Niharika, third number. Lab बंद हो जाएगा.
For the motion, sir.
For the motion, sir. ये मैं बंद कर रही हूँ. कुछ दिक्कत तो नहीं.
So, good evening. Clinical acumen. In the field of medical science, clinical acumen is described as the knowledge and the instinct that allows decision making on complex issues. Today, I will explain how this very indispensable skill in medical science has been hampered by the use of technology. And my argument is based on the fact that technology destroys the 3 C's that make a doctor: confidence, certainty, and clarity. So let's talk about how these 3 things are destroyed. There are 2 thought processes that are involved in every doctor-patient interaction. First is the intuitive thought process, instincts that have been developed through years of learning. If I ask you today, which is the most populous country in the world, you would straight away say it's India. But now, if I give you the option of cross-checking it on the internet before you give me your final response, many of you would avail that option. Why? Because we all want to be 100% sure, and technology allows us to do that. However, in 2015, a study was conducted at Yale University, which proved that every time we cross-check information that we already know is true, we lose confidence in our own retention of information and our understanding. So, my question is, if we do not give ourselves the room to trust our judgment and to make mistakes, how will we develop our instincts as a doctor? Now let's talk about the second thought process, which is analytical and evidence-based. Suppose your neighbor comes to you and asks you to interpret his father's blood test reports. Say his serum creatinine levels are 3 milligrams per deciliter. Now, you remember that serum creatinine is used to measure renal function. But you can't seem to remember the normal serum creatinine levels in a male. And you quickly go on the internet and check the levels and give your answer. Now, what happened here? This phenomena is called digital amnesia, wherein we do not retain information that we know will be stored in a device. And this phenomena was studied in May 2020 among healthcare workers, which found that there was reduced retention of essential information because of excessive reliance on technology. But nevertheless, say you do use an AI diagnostic tool to assess a patient's symptoms, and that tool makes an error and it gives you the incorrect answer of alkaptonuria, which we know has a clinical presentation of dark black urine on standing, but your patient has yellow colored urine. But because we trust machines more than we trust our own judgment, you might get confused and you may wrongly associate alkaptonuria with yellow colored urine. This is one of the 7 sins of memory. It's called suggestibility, wherein there is acceptance and even incorporation of false information into memory because of external influences that tend to confuse us. So here, we have a situation wherein there is no confidence, no clarity, and no certainty in the entire doctor-patient interaction. So coming to the definition, knowledge has been muddled by confusion and instincts were not allowed to develop properly, or they were rather replaced by technological input. So in the absence of these two factors, there can be no decision making on any issue, and clinical acumen is ultimately lost in the long run. So the question is not whether technology is an asset. The question is, why is technology being used in a way that it tells us what to think rather than how to think? Thank you.
Against the motion?
This was for the motion.
Are you sure? Just rethink once you go back home and recollect everything.
Okay.
First point. Second, going back before internet age, if somebody asks a question, person has to reply on its own memory and things. So how confident he used to be that time? Have you compared that?
Yes, sir, that's the study I talked about. That's the study I talked about, sir.
So can you repeat that?
Sir, in May 2020, there was a study conducted which assessed the impact of excessive use of technology among healthcare workers. And they found that when healthcare workers rely more on technology, then they do not tend to retain information which they know will be ultimately stored somewhere. So, yeah.
I appreciate you. You have got the studies for your support.
Yes, ma'am.
Definitely, I'm impressed that you are.
Yes, ma'am. Thank you.
No, I do agree with you, but at the same time, your clinical practice and your experience, that matters,
Yes, sir.
isn't it?
Yes, sir.
No, that is true. But at the same time, your practice and your experience, that matters more. And I think you should impress upon these things more than what you say at present.
Yes, sir. I said that we need intuitive thought process, which is developed through years of learning and experience. When you go to OPDs and you see patients time and again, then you realize, okay, if a patient presents with X, Y, and Z, then probably it's one of the three common things that happen every day.
No, these days, definitely, we can't spend more time on patient because number of patients is more and you are hard pressed. So you take the, help of technology. But I think we should, depend upon our experience and other things rather than technology, if you are for.
Yes,
Isn't
sir.
it? Thank you.
Your oration was very good.
Thank you.
I think you could have added some more content in your talk, but otherwise it was a good presentation.
Thank you, sir.
I think you have confidently put forth your thought process. Congratulations.
Thank you, sir. Is there a question?
Any question from the audience?
You mentioned in your speech that meditation we should give space for committing mistakes. But being in such a important profession where life and death situation may occur, and any mistake that you fatal, how could you justify not taking a second check for a patient instead of giving the space to commit a mistake just for personal memory instead of patient's care?
May I answer? Okay, sir, before we become consultants, we go through years of training. We are first interns, then we are junior residents, then we are senior residents, and then years and years later, we finally become consultants. And before we arrive at that stage, after an intern makes a judgment, that has to be reviewed by a senior. So that's when you make a mistake and your senior tells you where you made a mistake, and you go back and you introspect what thought process went wrong there, and then you make a better decision the next time. It's not that we are risking patients' lives. There are a lot of other seniors who are there to support us, and that's all education is about.
Now it's counter question allowed. It's counter question allowed.
As you mentioned, suppose we are clinicians now, we are consultants, and now you have a patient, very sick patient, who is on the verge of life or death. You have to make a decision. Now, you will take the decision on your gut feeling, or you will have a second consulting with a technology, use the technology. What will you do? You will use the technology, or you will say, no, I'm good.
Excuse me, please. In future, please take a permission that you are going to ask question. Then only, please, you go ahead. Please sit down. Thank you. You want to conclude in 20 seconds?
Sir, I think I'm done.
Thank you.
Thank you, sir.
Yeah, who is coming against the motion?
Yeah, Akshat from Maulana Azad Medical College, please come on stage. He will be speaking against the motion. Number 4.
First yes. So next one. English writer Neil Asher once said, "If I could time travel into the future, my first port of call would be the time when medical technology is at its best. Because simply put, like most people on this planet, I too have an aversion to dying. I wish a very pleasant evening to everyone present over here. This is Akshat standing before you, strongly opposing the motion present before the House today. Technology has blunted our clinical acumen. Let me take you to an era before technology, an era when the public was exposed to absurd practices like bloodletting by leeches in order to purify one's body. An era when they had to trust unqualified people like a shaman, a godman, or a king to cure their illness. Cut to today's time, everyone is grateful for modern healthcare, and this has only been possible due to the advent of technology. For example, we have achieved greater methods of delivering medication to the patient. We have achieved greater precision in pharmaceutical dose administration. This gives greater freedom to the patient. I can give numerous examples that every tool in the arsenal of a clinician has been reinforced by incorporating it with the latest advancement. One can only marvel at the extensive coherent organization of the medical records of millions of patients globally, and the fact that such a large reservoir is available for quick access to the professional at his fingertips, and blood work needed for quicker results and better diagnosis. Each examining instrument, from the humble stethoscope to the towering MRI machine, is just a minuscule component under the umbrella of what tech encompasses. Even after this assemblage of enlightening evidence, some of my simple-minded opponents may nitpick by asking, well, what about soft skills? Surely tech is concomitant with a cold, mechanized, and inhuman world where the fundamental essence of the doctor-patient interaction is deprived of its human interaction, right? Well, to them I say, please open your eyes and look around. Take the example of the recent COVID-19 pandemic. At that time, when an innocent patient was quarantining in a corner of his home, exiled even from his own family, the birth of telehealth services provided a way forward, ensuring the safety of both the physician and the patient. At that time, the communication of assurance by the doctor on a video call was all he needed. Technology helped to bridge the gap between the doctor and the patient. This also proves that clinical proficiency can't be perfected, but tech helps in achieving its near ideal form by creating a positive feedback loop. The more you look for cracks in the system, the better inventions you come up with to fill them, which leads to their application in adjacent areas, opening up even more avenues for innovation and research. I may expect some of my respected senior doctors to be a bit skeptical about the prevalence of tech everywhere, because honestly, they didn't rely on it as much as we do today. But I implore them to see that in no way is our existence threatened. If the skill of a doctor was solely derived from the experience of linking the symptoms to the disease, then we would have been replaced by machines long ago. His differentiator is the clinical experience and ability to observe the patient, his signs and symptoms, and make an educated decision. Proper use of tech can only help to enhance his proficiency. A good driver can traverse any bad road, but still a highway is helpful, right? It is said that to err is human, but doctors aren't mere humans, are they? In our field, mistake can be murder. We play God on a daily basis, and even God needs a prophet to uphold his will sometimes, and tech is ours. We must not end up like some of the alternative healthcare systems which are distrusted by everyone just because they are technologically illiterate. It helps to have an evidence-based, patient-centric approach to the clinical aspect of healthcare. Thank you.
Every person who is sick can get his diagnosis by seeing the reports and all. It is good for the patient.
No, ma'am.
It is good for the doctors. The technology is for everyone, not only for the doctor. The same technology patient is also using at the same time. So whether it is good or bad.
Ma'am, I don't think this will be good for the doctors, because they won't. Honestly, even if I was a doctor, I wouldn't want anyone questioning my authority. But if I can make the best of both worlds, I have my experience, but I am also keeping pace with the times by making proper use of technology. I think I'll be able to convince the patient that I'll be able to win his trust.
I don't have any question. I have two comments. Number one, you are mistaken that evidence-based medicine is based on technology. No, it is not based on technology. It is based on evidence. Yeah, with technology, it has become easy to extract the information.
Yes, sir.
One. Second, at least 20, 25 year older than you have been having access of technology, Medline and things like that.
Yes, sir.
People like me have not written a single prescription in last 20 years. It's the computer or the printer types it. So don't assume that technology is something which has come very recently, very fast. It's Medline. We used to use in early 90s Medline. So now it has come through internet. Previously it was through intranet. That is the only difference that is there. But Medline was there 30 years back.
Sir, so if I may speak,
I would have expected a better content. Thank you.
sir, if I may speak.
Please.
Sir, I was trying to oppose to the vocal minority which becomes active sometimes against technology. Clearly, if you have been using it and it is helping you, then surely it helps us clinically, as you said.
So due to lack of time, we won't be taking questions from the audience right now. Thank you, Akshat. So next we have students from Hamdard Institute of Medical Sciences and Research. So for the motion, we have Mohammad Adnan. Would you, where is he? Okay, so Yavar Arvag, please come on stage. Huh? From Hamdard Institute of Medical Sciences. So number 3, and he'll be speaking against the motion.
Sir, Yavar Nawab. सीढ़ियां उन्हें मुबारक हों जिन्हें छत तक जाना है मेरी मंजिल तो आसमां है रास्ता मुझे खुद बनाना है A warm good afternoon to one and all present here. I am Yavar Nawab from Hamdard Institute of Medical Science and Research. As the topic of today's debate is technology has blunted our clinical acumen. And I stand here against the motion and say that technology has only sharpened our clinical skills and our clinical acumen. The topic for today's debate is not whether technology is good or bad, but how it has affected our mind as doctors of 21st century. All physicians are smart, but being smart is not same as having good clinical acumen. Clinical acumen requires keen observation skills, patience, good examination skills, experience, and problem-solving capabilities. As clinicians, our sole purpose is to extract symptoms to form a diagnosis and to treat them in most efficient way possible. I would like to borrow some lines from the famous Bollywood movie, Three Idiots. As when the protagonist was asked about what is a machine, he replied with the example of a zip. I would like to give a same example of a stethoscope. A stethoscope is a technology to amplify sound. Should we say that a doctor relying so much on a stethoscope for examination is a less of a clinical skills? In earlier times, layman people used to say a good clinician is one who can tell the problem just by touching the hand. Coming from the medical college, whose foundation was led by Padma Shri, late Hakim Abdul Hakim Sahab, he was an exceptional physician, but always used the title of Hakim. We are the students of modern medicine, and yes, we are dependent on technology to some extent, but that only makes us best. Because of technological developments, healthcare has changed significantly from anesthesia and antibiotics to MRI to radiotherapy. In NHS United Kingdom, a doctor is supposed to diagnose a patient and calculate the dose using a computer before prescribing. In India, if we start using such technology, not only patients but our own peer groups will say, see how such bad clinician he is. He can't remember even the dosage. I ask you all, which doctor is better, using a technology or one solely dependent on past experiences only? As a doctor, we should not forget our first principle is to do no harm, and technology ensures it. A lot of times nowadays, it is observed that students studying from edtech platforms, watching videos for long hours, people say this technology has caused a decrease in clinical awareness in young budding minds. I want to remind you all that we are here from medical colleges in Delhi, the so-called metropolitan city, with our teachers being top of the field. But what about the government college in outskirts of Bihar or a private medical college in a dense town in Uttar Pradesh? With these technologies, learning from YouTube, a MCH surgeon oncologist specialist is teaching surgery. Only the scale of knowledge is uplifted. Yes, I agree. If one only watches video lectures, never attend wards, never interact with patients, he'll not going to be a good clinician. But whose fault is it? Obviously ours, not technology. As Allama Iqbal has said, and I quote, हंसी आती है मुझे हसरते इंसान पर, गुनाह करता है खुद और लानत देता है शैतान को. Algorithm based treatments has made us better clinicians only. Replacing paper with computerized summary has made patient care easier and more efficient. With the use of artificial technology, we can detect TB better than 2 radiologists. Does it mean that radiologists have no good nowadays? A big no. It means that radiologists can devote their time on more complex scans. Technology depends on us clinician, not vice versa, which was proved last week by the result of NEET PG counseling. Despite the buzz of AI, majority of top rankers, the bright minds of our country, took radiology as a first choice. I would like to conclude by saying that technology is a two-sided sword. If we use it correctly, it will increase our clinical acumen tremendously, and we have to move forward with the recent advances. We have to accept it. आंखों में पानी रखो, होठों में चिंगारी रखो, जिंदा रहना है तो तरकीबें बहुत सारी रखो. राह के पत्थर से बड़ी नहीं है मंजिल, रास्ते आवाज देते हैं, सफर जारी रखो. थैंक यू.
भाई पूरी 3 इडियट्स रिवाइंड करा दी, लेकिन कहना क्या चाहते हो? मुझे डायलॉग याद आ गया उसका. ये बताओ कहना क्या चाहते हो? What was the topic and were you for or against?
Sir, I was against the topic.
You were against the topic. What is the topic?
Sir, topic is technology has blunt our clinical acumen.
तो आप मेरे को तो लग रहा है for बोल रहे हो. You have said everything for that. You have not said a single word against it. मैं तो कंफ्यूज हो गया, मैंने अगेंस्ट फॉर अगेंस्ट लिख के यहाँ पर.
Thank you, sir.
नहीं, everyone is confused. The same confusion was with Niharika also. She was also not very clear. Please, at least those who are coming after him, just make it sure you are for or against. This whole talk was for. Yeah, he proved that technology has blunted.
Ma'am, I have said that ma'am, I was saying that technology is good for us as clinicians.
यार
I included the replacing of papers with computers.
हमें लगा नहीं यार, वो तभी तो मैं कह रहा हूँ कहना क्या चाहते हो.
Thank you, sir. Yeah. Thank you, sir. Thank you for the comments.
Mohammed is here now? So I'd request Mohammed Adnan to please come on stage. He'll be speaking for the notion. For sure.
Mohammed Adnan.
Start boss.
Today, presenting my case, I have less motive of debating, but to intrigue your minds with some rhetorical questions. Good morning to one and all present here. I, Mohammed Adnan, from Hamdard Institute of Medical College, is here to put my views on the topic, technology has blunted our clinical acumen. And I would emphasize I am for it. We have consumed ourselves in the world of online distractions, surrounded by plethora of dreams, sinking in the well of darkness, choosing our focus with our everyday routine. I hope everybody here would agree that increasing screen time reduces focus. The clinical bluntness began at the very beginning when we want to harness all the power of technology using these online classes and pre-recorded Zoom sessions. Don't we agree that this has brought a huge deflection in our learning method. I would certainly here question the effectiveness of online learning, which transcend into clinical insufficiency as our natural being. In-person classes definitely are more impactful than these pre-recorded sessions. Human mind is not at all designed to communicate like that. I pose here my first question. How many of you will agree to go on a coffee date on Zoom call rather than in person? Moving on forward, as doctors, we know human mind needs time to process things. And I would not be wrong to say that my fellow mates are happy to reduce that processing time using machines. Is it really counting up to our skills? I don't think so. Tech has just made us war slaves, slaves with swords, swords of mind that are left to rest, or I'd better say to rust. We have to remove the handcuffs of our own discoveries to discover more. Dependency on technology has overpowered our will to explore. Dependency on technology brings me to my second question. Are you all really sure that today's generation novice singers are really good music directors using technology? This just means that the YouTubers are greater director than Christopher Nolan. You all replaced our hard work with machines we accepted. You changed our socializing techniques. We kept quiet. But now when you are saying that it can enhance our skills, that is not happening at all. As science students, we must all agree the process of evolution, which led through our own DNA of physical experiences, cognition, and trial and errors. This brings me to my third question, which can be more intrigued than the previous one, I think so. Do you really think you can challenge the process of thousands of years with such a trivial thing that doesn't even existed 50 years back? I really think so. It is not gonna happen. I think it would not be wrong to assume the effectiveness of an electrically running piece of metal can never be more than our own hands. In anatomy we study, these are really catchy. Technology fails. I need not to remind my fellow mates, no tech hold a candle to the cognitive perception of our mind. As we all know, when laparoscopy fails, we have to split the body open, rely on our conventional methods. And all doctors sitting here would agree, needs experience. No one denies that it is admissively evident the best of the ophthalmologists across the globe still prefer specs over LASIK. I rest my case here, which reinforces an old saying that old fashion never goes out of fashion. Thank you. Good, sir. Can I go? Thank you. Yes, sir.
You have definitely talked like technology again, almost against the technology. But
Sir.
you should have related it to the clinical end. You have given multiple examples
Yes, sir.
that how that we can't depend on technology alone.
Yes, sir.
And of course, we need more of other things like socialization and all that. But it should be at the topic of the debate is as far as our clinical end.
Sir, I told.
Laparoscopy is a basically practical procedure.
Yes, sir.
It is not the clinical end. So the problem is the basic clinical classes, what you used to, what you read in your Hutchison's
Yes,
clinical
sir.
methods. Either we are using it or not today. How much we are depending on that? How much we are able to see a patient by appearance and other things and judge the things.
Sir, like.
So this is what we need to understand comparing the two. There was a recent workshop in pediatrics where we had the
the senior most pediatrician from Mumbai, Dr. Y.M. Wanderkar, and he enumerated multiple cases of so many difficult things which could be just assessed on clinical acumen, basic clinical skills. So it is not that technology is good or bad, it is how much is affecting our clinical acumen that we refuse to examine the liver. I remember a very common incident when I was doing senior residency. A junior doctor came, the intern. She said, "Iska liver ka," there was some discussion going on, liver size kya hai, ye kya hai, and kidney palpable hai ke nahi. Yeah, so they said, ultrasound करा लो, क्या जरूरत है ये देखने की. So this is
Sir, actually, I never said technology is bad. I just said becoming technology is bad. Thank you, ma'am.
The basic thing what Dr. Prashant want to say is the meaning of clinical acumen has been missing in all the talks which happened so far. What is clinical acumen? Is this generation forgetting the clinical acumen?
They are not understanding the meaning of clinical acumen because they have not seen that era of clinical acumen. Now they have been brought up in another era. The topic for them is really, I think, very difficult to follow. They are unable to tell for or against.
That's what I said in the first lecture itself, that your practice, clinical practice is missing. No
They are
experience.
undergraduates, so they are not they can understand.
कोई बात है.
They are trying.
Yeah, they're trying.
To examine the patient.
Okay, thank you, judges. Okay, next we have students from North Delhi Medical College. I'd request Nitansha to please come on stage. She will be speaking against the motion.
Please declare also what you are going to speak for or against. I don't trust her.
Against. Ladies and gentlemen, esteemed colleagues and honored guests. So I'm speaking against the notion. Today, we gather to explore the fascinating intersection that has reshaped the landscape of healthcare, the harmonious blend of technology and clinical acumen. In an era where rapid technological advancements often spark concerns over the potential erosion of human expertise, we must recognize that our journey through this intricate web of innovation has only fortified the pillars of medical excellence. Rather than undermining clinical acumen, technology has bestowed upon us a potent tool set that augments the capabilities of medical professionals. Advanced imaging techniques such as MRI and CT scan have granted us windows into the human body previously thought unimaginable. These technologies allows us to visualize intricate anatomical structures, facilitating accurate diagnosis and treatment decisions. Moreover, the advent of electronic health records and digital databases have expelled the retrieval of patient information, offering clinicians an expansive view of medical histories, allergies, and the patient records. E-records have not merely have reduced the clutter, they have also enhanced the capabilities of doctors and institutions to address medico-legal issues more effectively. The streamlined access to data empowers doctors to make evidence-based decisions, ensuring the pinnacle of care for their patients. Telemedicine, born of technological innovation, has dismantled geographical barriers, enabling doctors to reach patients regardless of the location. Just recently, our revered Lieutenant Governor, Shri V.K. Saxena, inaugurated E-Sanjeevani program at Hindurao Hospital. E-Sanjeevani offers patients 24/7 OPD services via video conferencing. Flagship initiatives like these in our nation exemplify how technology can revolutionize healthcare in a nation like India. A 2020 research by Amarta Ghosh, Ritesh Gupta and other underscores the undeniable significance of telemedicine, especially during COVID-19 lockdown. The vast repository of medical knowledge available online keeps doctors abreast of the latest research, treatment protocols and emerging therapies. Additionally, the pervasive availability of biotech diagnostic technologies allows Indians to access these services affordably. A 2020 study by Nath Healthcare indicates that when adjusted for inflation, the prices of the most frequently prescribed tests have decreased by 10%. While a robot or AI cannot emulate human emotions like empathy, compassion, and genuine concern, this distinction might be their strength. The human mind, although remarkably is imperfect, our evolutionary traits have predisposed us to form judgments on opinions, often involuntarily. Machines, when programmed correctly, are free from biases. They don't judge. They aren't based on the judgments. They don't judge. They are designed to have biases, ensuring every patient receives uniform treatment. However, we must acknowledge that literature on the application of AI technologies in medicine remains limited as it's still an emerging field. In conclusion, let us acknowledge, as we progress more and more, the soul of healthcare remains undeniably human, but only with the technology acting as a conduit, magnifying our innate ability to heal. Thank you. Welcome.
Sir, please come on stage. I request Dr. P.P. Sethi to please join the judges, please. Next is Yash Agarwal here. Yeah, you know? Hi, Ajay. He'll be speaking for the motion.
Yes, sir. Ladies and gentlemen, esteemed judges and fellow debaters, today I, Yash Agarwal, student of North DMC Medical College, stand before you to argue in favor of the motion that technology has blunted our clinical acumen. Kristen Lange rightly said, and I quote, "Technology is a useful servant but a dangerous master." While technology has undoubtedly revolutionized healthcare, it has also brought with it a set of challenges that impact our ability to diagnose and treat patients effectively. Firstly, let's consider the impact of technology on our diagnostic skills. With the advent of powerful imaging tools and diagnostic machines like MRI and CT, doctors may rely more on these technologies rather than honing their ability to identify subtle clinical cues. This can lead to a decline in the finely tuned observational skills that were once the hallmark of a skilled clinician. Furthermore, the rapid availability of information through digital platforms has led to the tendency of information overload. Instead of relying on their own clinical judgment and years of experience, medical professionals might become overly reliant on quick online searches or clinical decision support systems. This could compromise the development of the innate clinical intuition, which is often vital in making accurate and timely diagnosis. Moreover, the human touch and empathy that are integral to the patient care may diminish in the face of technology. The focus on screens and devices can inadvertently create a barrier between a doctor and a patient, making it difficult to establish the trust and connection that are crucial for effective medical treatment. The art of listening and reading non-verbal cues can be undermined when the bulk of interactions occur through the screens. Even more concerning is the potential for technology-induced biases in the diagnostics. algorithms used in medical decision support systems have been shown to have biases towards certain demographics, leading to misdiagnosis and unequal treatment. Lastly, technology has also led to decrease in hands-on procedural skills. The risk of robotic surgeries and automated procedures might decrease the opportunities for medical professionals to practice and refine their tactile skills, potentially impacting their ability to perform intricate procedures without the assistance of the machines. A retrospective study published by researchers at University of Illinois, MIT, and Chicago's Rush University Medical Center stated that despite widespread adoption of robotic system for minimally invasive surgeries, a non-negligible number of technical difficulties and complications are still being experienced during procedure. According to the report, 144 deaths, 13,991 injuries, and 8,061 device malfunctioning were recorded out of the total more than 1.7 million robotic surgeries carried out between January 2000 and December 2013. In conclusion, while technology offers countless advantages in the medical field, we must not turn a blind eye to the potential drawbacks. It is essential to strike a balance between embracing technology and preserving the fundamental clinical acumen that has been the backbone of medical practices for centuries. Let us remember that technology, no matter how advanced, cannot supplant the essence of humanity that defines the healer's art. The empathy, the sympathy, and the unyielding sense of concern that resides in each of us is a beacon that technology cannot replicate. As we march onward, the heart of healthcare remains steadfastly human, while technology serving as an instrument that amplifies our capacity to heal. Thank you. Thank you.
Thank you. So next from Baba Saheb Ambedkar Medical College, I'd request Harsh Kumar Arora to please come on stage. He'll be speaking
Ladies and
against
gentlemen, I am here to tell you what the truth. But before that, Namaste, Adab, Salam sabhi ko. मैं हर्ष कुमार अरोड़ा today stand here to present my views on the topic technology has blunted our clinical acumen, and I strongly opposes this motion. Well, some says that technology is making them less skilled, but let's just actually deep dive into this condition and see what actually happening. Let us first acknowledge the stride that technology has brought into this field of medicine. Advanced diagnostic tools such as genetic engineering, such as medical accessing has revolutionized the precision and accurate time diagnosis. Research study says that doctors who have inculcated this into their clinical practices have helped them for accurate and timely decision, and along with that help them in making a right treatment at a right time. Along with that, I would highly like to emphasize the research studies that was published in the Journal of Clinical Oncology, which highlighted this fact that early detection through this imaging technique has led to 25% increase in the last 5 years of survival rate in breast cancer patients. Isn't this amazing? Furthermore, let's just talk about technology, how this has opened the gateway to an unparalleled wealth of education. Like nowadays, you are just one click away to access various medical theses, to online forums, which can help you to acquire countless number of information, which can eventually help you to become a better clinician. Isn't this still make a sense to you? Let me quote one more study. A study done by World Health Organization found that doctors who inculcate global medical insight into their practices demonstrated greater efficacy in patient care. In the era where medical breakthroughs are happening along the continents, it is one of the major need of the hour. Let me quote one more argument to prove my stand strong. In addition, technology fosters a culture of collaborations among medical practitioners. Telemedicine, virtual consultation transcends geographical boundaries, enabling doctors to seek second opinion and also to share up their expertise on complex cases. An analysis done by National Center of Biotechnology highlighted the efficacy of collaborative approaches, noting that the collective input from multiple specialities has significantly enhances the diagnostic accuracy. The interconnectedness elevates the quality of healthcare, ensuring the diverse perspective converging into medical to unravel the intricate medical experiences. Technology often seen as a tool to complement other skills rather than just replacing them. Doctors still use their observation, intuition, their knowledge, their experience to provide an extensive, comprehensive care. Admittedly, some might argue that over-reliance over this technology might lead to missing out certain critical clinical cues. Well, I would like to emphasize on this fact that technology serves the purpose to amplify, not replace. Let me emphasize on this fact again. Technology is designed to amplify and not replace the clinical acumen. Hence, the doctor continue to harness their intuition and observational skills while leveraging technological advantages. The partnership between clinical expertise and the technological innovations is helpful in accuracy and correct thoroughness of the diagnosis. In conclusion, while the skeptics may say that technology has dulled our clinical acumen, well, the evidence reveals a totally different narrative. Well, I would surely say the advancement in diagnostic tool access to the global medical education and the platform for collaborative inputs has tremendously helped the healthcare professionals to achieve great skills in their respective fields. Remember, at last I would surely say that it's not a question of technology blunting our clinical acumen, but rather the technology enhancing and refining it. Thus, I would like to emphasize on this fact that technology is not blunting our clinical acumen, but enhancing and refining it. With this, I rest my case, but definitely not my argument.
Thank you, Harsh. Is Vyomesh Rastogi here? Okay, so we'll move on to UCMS and GTB colleges. I request Pridhi Chahal to please come on stage. She will be speaking for the motion.
Martin Luther King Jr. once said, "Nothing in the world is more dangerous than sincere ignorance and conscientious stupidity." A very good evening to respected adjudicators, members of the opposing team, and the lovely audience. Today, I, Pridhi Chahal, stand before you speaking for the motion. The assertion in technology has blunted our clinical acumen is not an indictment of progress, but rather a call to carefully navigate the pathway ahead, ensuring that the essence of our medical profession remains intact. There is no denying that technology has has modified and revolutionized medicine. But what about the other side of the coin? Technology can provide objective data, but it misses the contextual and subjective aspects of patients' history and conditions. What about the ability to read body language, listen to patient's tone, observe subtle physical cues? Do they not hold a significant part of our clinical acumen? Can technology capture that? No, it cannot. Mere negligence of the power of observation. Power of observation is an integral part of our clinical acumen. What about the potential loss of problem solving and hands-on skills? What about the plausible cognitive bias which can result from clinicians subconsciously prioritizing technology-generated data over the clinical judgment? What about inhibition of clinical curiosity, diminished learning from mentors, and depersonalization? Ladies and gentlemen, these are not mere anecdotes. If not convincing enough, let's talk in terms of facts and figures. A study published in the article of Medical Education Online highlights the potential impact of technology on our clinical judgment. Technology hampers the entirety of the nuanced decision-making progress that clinicians engage in, undermining the vast experiences that they accumulate over their careers. Reports by Deloitte found that patients increasingly feel like data points due to growing reliance on technology, the negative impact on the doctor-patient relationship, which is indeed the very foundation of any treatment. The study published in JAMA Medical Medicine in 2019 sheds light on a significant concern within the medical field: diagnostic errors. The study emphasizes on the potential pitfall, yes, pitfalls of technology. Indubitably, technology can provide precise data, but it cannot capture the intricate interplay of symptoms, medical history, and patient presentation that seasoned clinicians can. Even the Institute of Healthcare Improvement highlights the same. The report's message is a reminder that patient-centered care isn't solely about diagnosing and treating medical condition. It's about the human touch. I'm sure everybody sitting in this room, including the people who are speaking against the motion, will agree with this fact that technology cannot replicate the human touch. So why are we letting it hamper us? The survey conducted by Medscape in 2021 made a concerning revelation that a significant portion of healthcare professionals themselves believe that technology has declined their clinical acumen. I repeat, medical professionals have themselves accepted the fact that technology has declined their clinical acumen. Let us also consider an article from PubMed. A shocking revelation was made. Healthcare sensors can be acquired off the internet, potentially opening doors to the unauthorized access of personal and clinical data. This reality underscores the gravity of our conversation itself. Credit card-sized computers and a few biomedical sensors can be bought at just the same cost as a drug prescription. What I'm saying is not an elegy of the past or a lament for the present. Believe me, our clinical acumen is not just a collection of data or algorithms. It's an orchestra of experience, intuitions, and connection with the patients who entrust us with their lives. Ladies and gentlemen, while we celebrate the advancements of technology, we must not forget the drawbacks. The studies that I have shared today serve as a reminder that preserving our clinical acumen is not an option, but our responsibility. We are answerable to our patients. The patient before us is not just a collection of data points, but a person seeking our expertise, our judgment, and our empathy. Don't you think we should uphold the time-honed values that define our Nobel profession, our clinical acumen? I leave you to answer that. Thank you. Thank you, sir. Thank you.
Thank you, Pradi. Next, we have Sanjeev Sharma. He'll be speaking against the motion.
Uh, 22 batch, so I'm first year now. Good evening, respected judges, fellow participants, and everyone else present in this thoughtful debate. I'm Sanjeev Sharma from UCMS, standing against the motion that states deterioration of the clinical acumen of doctors due to technology. I'll start off by highlighting the major chunk of perspective and information that everybody will be giving you about how technology has improved the healthcare. They'll everybody come in, they'll conventionally say you, which is also easy to prove, that technologies like X-rays, MRIs, CTs have improved healthcare. Technology has resulted in better drug trials, better drugs, advancements in pathological, radiological studies has given better healthcare, eventually better doctors also. Is this all true? Yes, it is. But is this all what clinical acumen actually is? Not exactly. Quoting the Indian Journal of Physiology and Medicine from 1976, if every drug in this world is abolished, a doctor of medicine would still be a very useful member of the society. Having said that, a good clinical acumen is not only means to be a better way to predict and implement or use these tools, but it is the ability of a doctor or clinician to be able to help and predict the cause and solution of a patient's problem without even such any tools. So has technology blunted this ability? Absolutely not. But I believe it has only done good to enhance clinical acumen of doctors. Now that we know what clinical acumen is, let's see how. First and foremost are huge electronized record and data which are easily accessible. There's nothing unfamiliar to us doctors about the voids in information, lack of information, and the lack of authenticity in the records and information that patients present to us. Now imagine the advancements, the information or the way of tools that technology
And if you could have better records, the analysis is directly made easier. And this analysis being easier leads to better abilities to help them, better clinical acumen as well. Next are patient personalized records and real-time monitoring devices. Technological endeavors like portable vital meters, easy to use BP apparatuses, health apps, smartwatches, etc. have made the tracking of patients so easy and not only bettered the clinical acumen, but in the analysis of such patients, but also creating personalized treatment plans as well. Now, what does these personalized treatment plans mean? These also mean a better patient to clinician relationship. Now, a better relationship, the patient is going to open up. The patient is going to trust you. He's going to trust you. He'll give you better information. Better information means better analysis. Better analysis means better clinical acumen. Next up, coming to my next point, I would like to highlight the doctor-patient relationship according to Indian Journal of Physiology, Medicine. They say it is a relation-centered care, RCC, where the responsibilities are divided in 3 ways. Patient to physician, physician to patient, which I already very well talked about, and third and a very integral part which many of us forget, physician to physician relationship. Now, what does technology do in here? The implementation of advanced communication tools does 2 major things. First is the standardization of clinical environment, and second is a trustworthy and smooth flow of information amongst the clinicians themselves. This not only frames a perfect space for discussing patient care, but also creates excellent ways to develop the analyzing skill and clinical acumen of new clinicians. Juniors learn from seniors, seniors learn from juniors, juniors learn from each other. That's true. Next up, I put up a very interesting trivia loop, the loop of decreased workload that technology has made. I already talked about the direct advantages of how technology can improve our analyzing skills and acumen. But now let's talk about an indirect perspective in here. Imagine the number of patients who are treated easily, faster, and with very less or almost no intervention of a clinician just because of these better technological methodologies and diagnostics. What does this do? This decreases the workload on clinicians. Decreased workload means decreased number of patients. Decreased number of patients means increased number of time with individual patients. Increased number of time with individual patients, better analysis, and eventually a better clinical acumen as well. Also, again, the introduction of better techniques automatically leads to an even better extraction of research data and useful information from these patients. Better again, better research, better information. Better information leads to better analysis and eventually a better clinical acumen. Now, I'll conclusively say that my closing statement would be this debate is just a very small part of a bigger goal for us as a medical fraternity, which is the provision of best healthcare and treatment to patients. And if it goes along with technology, so be it. And I have summarized very well better records and accessibility, better physician-patient relationship, better personalized records, standardization, loop of decreased workload, better research tools that totally disprove the denting of clinical acumen in the hands of technology. Thank you.
Thank you, Sanjeev. Next, I request Arnav Mishra to please come on stage. He'll be speaking for the motion.
Good evening, everyone. I am Arnav Mishra, and I speak for the motion to support the notion that technology has blunted our clinical acumen. At the beginning, I would like to flat out state that I'm not against the use of technology in the medical practices. However, I strongly believe that their use should be to supplement our clinical procedures, not to replace them. Nowadays, we often see a small minority of clinicians recommending a whole bunch of tests, even if they aren't necessary. It's often done to make up for the inadequate clinical skills. So their approach is to order all the tests and see what sticks. This cannot be the way forward. I believe that this will lead to a vicious cycle because their dependence grows over time, and such doctors won't do very well in cases of emergency or in rural services where resources and technologies aren't available. Another trend that I've noticed is ironically in government setups. I've noticed in my own anecdotal experience that government set up doctors often prefer patients who already have all the tests done because it tends to reduce their workload and the time they have to spend on a patient. Due to the enormous workload, the government set up doctors usually have 4 to 5 minutes only per patient, and when the patients have already had the test done, it leads to the patient doctors preferring them. But if you look at it closely, it's a huge waste of resources and time on the part of both the government as well as the patient. Secondly, if we consider more advanced diagnostic tools or the artificial intelligence dependent tools, we realize that the diagnosis and treatments have become algorithm driven and formulaic. It's too simplistic to be applied directly to the real world because they don't take into account the patient history, the patient allergies, the environment in which the patient grew up, the family history, the availability of the resources for the treatment. And therefore, in the very real sense, in the real clinical activity, they are useless. Furthermore, I believe that another algorithm needs to be mentioned which guides us towards a diagnosis from the commonest to the rarest one according to the frequency at which the disorder exists. However, the issue here is that it will make the diagnosis of rare conditions even more difficult to diagnose and treat. Therefore, treatment will get delayed and much resources will be wasted. For example, a case of Cushing syndrome may be misdiagnosed as a complication of an untreated diabetes mellitus. It has been seen recently in European country due to which this algorithm needed to be shut down. And my point being that over-dependence on such algorithms leads to technology-induced complacency. Furthermore, when a doctor depends too much on diagnostic technology, they struggle in cases of false positive and false negative cases. To eliminate them, we need a good problem-solving skills to proceed to eliminate as many possibilities as possible. However, when overzealous use of technologies causes an increased chances of false positive and false negative tests, which will eventually lead to a misdiagnosis. As one of my seniors in the Department of Radiology office says, that overzealous pursuit of technology has led us to chase artifacts instead of actual cases. Now let's look at the medical education. When budding clinicians are allowed to use technology overzealously and prematurely, it leads to a situation where their clinical analysis skills aren't refined. Medical education requires a balance between theoretical knowledge as well as clinical analysis, and I believe that a premature allowing them to have access to the diagnostic tools hampers their growth as a clinician. Personal interaction with patients decreases with the overuse of technology, which hampers them from picking up subtle cues, the subtle signs and symptoms which will be lost due to over-dependence on technology. This is particularly important in a population such as India, which is predominantly not educated. So very often we see in clinical settings that a patient complains with a pain in his leg or using vague terms to denote his discomfort. It is the job of a clinician to convert that illiterate statement, that vague complaint, into at par with what the scientific literature says. That can never be replaced by a soulless algorithm. These intricate human interactions in the clinical setup can only be taken care of by a human. In the end, I would like to ask all of you to consider this from the perspective of a patient, because at the end of the day, that's why a fraternity exists, to take care of the patient. Thank you.
I'd request Shivansh Tiwari to please come on stage. He'll be speaking against the motion.
A good physician treats the disease. A great physician treats the patient who has the disease, said Sir William Osler, one of the founding professors of Johns Hopkins Hospital. Good evening, respected judges and fellow participants. I am Shivansh Tiwari and I stand before you to speak against the motion that is, technology has blunted our clinical acumen. Here's one anecdote I would like to share.
There was a male infant in neonatal ICU in Kansas City. His liver failed. No one was able to reach a diagnosis. A genetist, Sir Kingsman, sequenced his DNA, used specific softwares to reach the genomes based on symptoms, and later he inferred that it was a rare mutation which led to overactivity of immune system and damaged the liver and spleen. This, for me, is the epitome of how technology has enhanced the clinical acumen. Now let's talk what clinical acumen is. It is the ability of a healthcare professional to combine clinical skills and practical knowledge in order to provide a just and sound understanding of a patient's health. High quality data is critical to meaningful policy making and efficient public delivery. These are words of none other than our own revered Prime Minister, Shri Narendra Modi. Technology provides vast amount of medical information, patient's data, history, results and previous medications. This aids in more holistic approach towards the treatment and definitely the better results. Medicine should be patient-oriented. It should be patient-specific, and hence tailor-made treatments according to patient's requirement and genetic makeup is need of the hour. Many modes of artificial intelligence is already being used by pathologists, radiologists, and dermatologists for image analysis, and it has led to faster and more accurate diagnosis. In field of ophthalmology, wavefront technology is being used to understand suboptimal results of laser vision correction. It is also being used to deliver much better outcomes. As we know, waveform LASIK is being popular and it is much more precise. It is precise to 0.01 diopters in comparison of normal old-fashioned LASIK, which was for about 0.25 diopters. According to studies, a human brain perceives an image 60,000 times faster than a text. In fields of radiology and surgery, which solely depends on a clinician's visualization ability, use of artificial intelligence and robots will enhance the surgical procedures' precision and accuracy. In a research conducted in 2018 published in PubMed, it was proved that clinical case study improves the clinical acumen. Technology assists a clinician to take up more number of cases in less duration. It helps him connect to patients virtually. Now let's just imagine a clinician sitting in Delhi wants to connect to a person belonging to a tribal group in Jharkhand. We know consanguineous mating is highly popular in much tribal groups. He gets exposed to rare genetic diseases which he or she would not have gotten in a metropolitan cities. Then we also know clinicians get to interact, improve in such a diverse country as of India, which improves his or her interpersonal skill and makes him a more or a better clinician. Then I firmly believe technology is the future. Clinical expertise can go a long way in improving and revolutionizing healthcare along with a clinician's expertise. Clinical acumen is not just about bookish knowledge, it is about a clinician's ability to connect with patients, empathize, and provide that personal touch that is much required. Technology helps a clinician reach these endeavors. At last, I'd like to say, take time to plan. Take time to plan, but don't take too long to act. Success belongs to those who make a move, so let's just accept technology and move along with it. Thank you.
Thank you, Shivansh. I'd request Ankit Kumar Modi to please come on stage, and he'll be speaking against the motion.
Good evening, everyone. First of all, I'd like to congratulate all the fellow debaters for their amazing debating skills. Ladies and gentlemen, my esteemed judges and my fellow debaters, I'm Ankit Kumar Modi, a final year medical student from University College of Medical Sciences and JTB Hospital, and I'm here to stand for against the motion on the topic that technology has blunted the clinical acumen. I want to start with a sentence like, can we imagine a health system without the absence of thermometer? Can we imagine a health system? Can we imagine a lab investigation without a blood test? Can we? We not. We can't. Basically, the technology and the clinical acumen, these are not two exclusive things. These are parallel. They go parallel with each other. The technology has helped the clinician to make the vast majority of data that a human can't analyze into a simple driven technique that helps the clinician to make the accurate decision and perform the personal care for his patient. And this technology is not something that came on its own. This technology is actually given by some human person. These are the creature of some human skills. So I would not say that the technology has something different, but actually the creature of the human skills. So as a physician, we are using that technique and combining with our medical skills to help the clinician, to help the physician to make a correct diagnosis. And what technology has given us, that it formulate a newer techniques, a newer latest study that we involve for the treatment plan, like the latest guidelines that we search on the internet for the various diseases, and like the robotic assisted surgery. Like, I want to ask people, like, we all have seen in our homes the Nokia phone, right? Like, but nowadays we don't even see a single Nokia phone, barely we see. Why? Because the company has not evolved with its current ideas. They have not followed the technology that other companies follow, and that actually left the Nokia company behind the other company. Similar thing goes with the physician. If the physician don't allow the integrity of the technology with his skills, they must get led behind the others physician or others technician in the treatment of the patient care. So these two things, the technology and the clinical skill, they go parallel with each other. Also, in the field of the technology, as we go, like there are so many data, there are so many technology, but if we go in particularly in the rural healthcare, the technology has gained enough in several care that we are able to provide the health system in the rural areas, and thus we are able to reduce the morbidity and the mortality. The study published in the PubMed shows that the integration of the AI and the human provides the 84% more accurate diagnosis than the single human or single computer-based technique. Another study that's published in the New England Journal of Medicine shows that during the COVID-19 times, the telemedicine has came as improved technique providing the healthcare system. So I just want to focus that these two are the same integrity made by the humans, and we should follow the same just single intricate technique for providing a better healthcare. Thank you.
Is this thing Anish here? No, no? Okay. Thank you. So next we have students from Lady Hardin Medical College. I'll invite Noor Afsha to come on stage, please. She'll be speaking for the motion.
A very good evening to everyone. My name is Noor Afsha, and today I am going to speak for the motion about how technology has blunted our clinical acumen. It is evident that the progressive development of technology has greatly added to the healthcare facilities, making them more advanced and reliable. But if we consider the another aspect, then actually it is deteriorating our conventional clinical skills. Nowadays, clinicians are totally dependent on advanced assays and tests for making their diagnosis. They are too lazy to take history and to perform other clinical examinations. Some non-experienced just prescribing all the serum, all the urine tests and radio assays without ruling out in which direction their diagnosis is going. And what are the specific tests necessary for that condition. Technology is ruining the basic skills, which are the pillars of medicine, like percussion, palpation, inspection, and history taking. And honestly, for the clinician, it seems to be so easy to just prescribe MRI, CT scan, X-ray, rather than doing all these things. Without considering the fact that how harmful the repetitive exposure of these radiation can be for the patient. Speaking further, due to highly advanced technology, the candidates who have a good grip in basic skills and conventional knowledge tend to lose their confidence, as they think that they can't handle the clinics as they involve technical gadgets and equipments. One can think that what is the need of those conventional skills when today we are having best technology for diagnosis and treatment of almost every disease. But imagine a situation when you are out for an adventure trip in a forest which is located in a remote area, and suddenly one of your friends just collapsed. Then what all you are supposed to do is to give him a CPR, and no one there is going to arrange a ventilator machine for you. Also, technology involving teaching the medical students via virtual meetings and classes, online classes, can really be effective? I don't think so, because probably these would be the students who would be the future doctors treating their patients via virtual meetings, which seems to be totally a blunt. Hence, all I want to say is that the idea should be providing healthcare facilities by compiling both the manual conventional skills and the technology, rather than totally depending on technology. Thank you.
Is Amna here? No, right? So next we have students from AIMS. I'll request Manali Agarwal to please come on stage. She'll be speaking for the motion.
A very good evening to all. I'm Dr. Manali, and I'll be speaking for the motion, Technology has blunted our clinical acumen. First of all, let's understand what is medical technology. Well, it refers to the application of science for developing solutions to health issues, such as prevention and delaying the onset of disease, and for monitoring and promotion of good health. Acumen is the ability of a clinician to make good judgment and quick decisions. Well, as far as statistics are concerned, technology has come a long way, and we are in a day-to-day life, and it has definitely taken over our lives. We've all heard of robots being used in robotic surgeries. They are being used in hospitals to deliver meals to the patient. A fully automated lab consists of robotic arms. Drones are being used in some peripheral parts of United Kingdom to take blood samples from patients. We've all heard of electronic health records, telemedicine, smartphone apps, and various other examples of technology being used in healthcare. While such advances can seem a lot convenient and they are easy to use, they do come with their own drawbacks and disadvantages. And the most important is how they affect our clinical acumen. Well, what I believe is clinical acumen is something that all of us acquire over years of training, hard work. We invest our initial 10 to 15 years of youth in medical education, getting trained, and that is how we acquire it over time. It doesn't come overnight. And if we do not keep using it, and if we have a lot of reliance on technology, if we become complacent, we will definitely lose it with time. I would like to explain this with an example. For example, telemedicine. So telemedicine is very convenient for the patient because they can book an appointment with the doctor and the doctor sees them virtually. Well, if we go back to our basics, during our training years, we learned that a sense of a good diagnosis is based on observation, percussion, palpation, and auscultation. When you're examining a patient virtually, I think most of this is lacking. You're just seeing an image of the patient on the screen. So when the pillars that we learned during our training are missing in our diagnosis while we are using such form of technology, how are we doing justice to the diagnosis made in such a way? Our holistic approach to diagnosis is lacking in such a consultation with the patient. The patient is not holistically approached. The doctor-patient relationship and the empathy that should exist is definitely lacking in such kind of a scenario. Also, when we promote and when we advocate a lot of use of technology, gadgets, and applications in undergraduate training or postgraduate training, we are actually depriving the students of the hands-on and the clinical experience that they could be learning during those years. And later on, they will become clinicians who may be very well adept with the technology and the gadgets and applications, but the hands-on training will definitely be lacking. Another thing that I would want to point out is that these applications and gadgets, they come with their own errors, with their own rate of errors. And if we are just blindly trusting them, we become complacent. We tend to just reproduce the same report to our patient, which can lead to unnecessary treatment, sometimes erroneous diagnosis. So my friends, just imagine a situation, maybe perhaps 10 years down the lane. We have lost most of our clinical acumen, clinical skills, but we have a lot of robots around and we have a lot of application gadget software. And God forbid if there is an outbreak of a deadly virus. We really don't know the structure of the virus because that was redundant, because the technology was teaching us about it. We don't know how to develop a vaccine. We don't know about the structure of the virus. I don't think we will be well equipped to tackle that kind of outbreak, perhaps 10, 20 years down the line, if we become too complacent right now. So all I want to say is that human intelligence is required to feed artificial intelligence, and we cannot rely too much on technology. We need to keep our clinical acumen intact. Thank you.
Thank you, Manali. I'd request Aryabhatta Sadhu to please come on stage. He'll be speaking against the motion.
She was Dr. Manali. Hello. Should I start? Yeah. Good evening, everyone present over here. Today, we all are gathered over here to debate upon the topic that whether technology has blunted our clinical acumen or not. So let us first define what technology means. Technology is equipment or method to achieve a specific desired task. And acumen means to have the ability to clearly and concisely take decisions and make judgments. So when we look at our current standing in our healthcare use of technology in our healthcare, what we see is human beings have treated their fellow companions since time immemorial. We were always limited by our existent technology with what amount of impact of treatment we could provide to our fellow companions. In our Stone Age, we could not do much because science, technology, none of that was developed. In today's world, when science has developed such a lot so that we know about every genetic basis of most of disorders, our technology has developed fairly enough that we can cure most of diseases. Our technology is developing in such a way in today's world that we can even cure and diagnose diseases that we could not even think about even when I started my journey in my medical career as an MBBS student 10 years back. So when we look at the consensus of today's debate based upon whether technology has blunted any clinical acumen or not, individually per person basis wise, it has not at all blunted anybody's clinical acumen. Rather, it has strengthened our clinical acumen to the point where diseases that were even entirely in the realm of science fiction 20 years back are routinely diagnosed, cured for, and even treated in today's world. Most people have this consensus or have this phobia regarding technology, where technology would blunt our human intelligence or human interaction in such a manner where human beings would forget about how to do basic things that they are competent to do right now. That's a very redundant way in how earlier we used to navigate looking at stars. Do anybody would prefer navigating with stars in today's world? We use GPS. That is what common sense is. If something has progressed beyond the ability of human normal organs, we would take use of that and hence use it so that we can do things that our normal human senses, human organs can't. So that is how any acumen or any development should progress. Let us look at how ChatGPT has impacted our world in the last 6 months. Prior to December, we used to believe that Google was very inefficient in medical diagnostics. Relatively, truly speaking, that is how it was because Google didn't understand context. ChatGPT, on the other hand, being a natural language-based model, understands context so well that in multiple studies in the last 6 months, it has aced USMLE exam. It has been used in NHS, in ICUs to administer patient doses. It has been used to manage patient outcomes, and the outcome rate using ChatGPT, without using ChatGPT, is always far superior using ChatGPT. So the more and more we keep on using technology in our medical practice, in our day-to-day practice, the better our clinical acumen will become instead of it dampening anyhow. Me being a hematologist, I'll look at it from an oncology point of view. Multiple blood disorders were impossible to be diagnosed to the specificity that we can diagnose it today, and that we can do only based upon the amount of clinical expertise we developed using technology, not running away from it. So what we should rather be focusing upon as a society, as well as we all learned people, is how better can we incorporate technology in our clinical acumen development and not ask whether it will dampen it or not. It won't dampen it, it would only enhance it. So I would like to conclude my discussion with that idea. Thank you. Thank you.
Thank you. So time for our last two entries. Garrick Biswas from Army Medical College. He'll be speaking for the motion.
You get an ultrasound, and you get an ultrasound, and you get an ultrasound, and you get an ultrasound, everybody gets an ultrasound. In this day and age of ordering tests left, right, and center, we find ourselves amid this conundrum, and yet there is no going back. Honorable Chief Guest, esteemed jury, and the august gathering present here. Good evening. Today, I stand before you to present my views for the motion. First came fire, followed by the wheel, and then came the laparoscope. In the past 100 years, technology, especially medical technology, has come a long way. And with them came a dependence on gadgets, gizmos, and artificial intelligence. The practice of medicine is an art, not a vocation. There was a time when inspection, palpation, percussion, and auscultation, with hands as the instrument, was the holy grail. But this art is now fading in the sands of time. Some of the very fundamentals of a clinician have been subsumed by machines. History taking is fast becoming an admired talent instead of it being the minima. Even prescription writing has fallen prey to the age of digitization. How often do we see doctors carry stethoscopes anymore? How often do we see them palpating an enlarged liver and not just ordering an ultrasound? How often do we see them do a general physical examination? A pulse oximeter may tell you the rate, but the humane connect formed by holding a patient's hand, the feeling of familiarity experienced, that can never be replicated. This malignant dominance of technology over clinical skills that we see has opened a deep chasm in the doctor-patient relationship. Patients are now inclined to trust a lab report more than the doctor's differentials. A clinical diagnosis has almost become unacceptable to these Google-empowered patients who only see this as a commercial transaction. Doctors' roles are getting relegated to that of mere test ordering bots. Is this how we wish to be seen? Clinicians are forced to care for the maximum number of patients in the minimum number of minutes, rather than taking the time to properly examine a patient and give them the due diligence they deserve. The detrimental effect of it has been the obfuscation of clinical skills, making us slaves to the machines that we created, the supplement a diagnosis and not form it. The dependence on this technology has made it impossible for some to function in a scarcity. Getting posted in a primary center where machines can't come to our rescue, what will a hyposkiliac doctor do then? The current trends have shifted from a high-touch medicine to a high-tech medicine, which completely bypasses history-taking and physical examination, jumping directly to a plethora of investigations. The doctor starts treating the symptoms and not the patient. We cannot exclude technology, but we must at the same time not be lulled into a false sense of complacence and dependence on artificial intelligence, an epitome of technological advancements, might I add. We need physicians who first use the stethoscope, not an echocardiogram to detect valvular heart disease. Physicians who first use the ophthalmoscope, not a magnetic resonance imaging to detect intracranial hypertension. Physicians who first use their hands, not computed tomography to detect splenomegaly. And physicians who always use the God-gifted technology of touch, the healing touch with an override of brains. Thank you.
Thank you. I'd like to call upon our last participant, Bhagyadar, to please come on stage. She'll be speaking against the motion.
All of us sitting here, my dear batchmates and respected seniors, have at some point been the infamous COVID batch of their year. We were mocked for utilizing technology, but for many of us, it was a godsend. Good evening. Today I, Bhagya Dutt, will speak against the motion, technology has blunted our clinical acumen. The introduction of technology in any field is met with resistance initially. I'm sure we've all heard that digital sphygmomanometers don't have what a mercury one does, yet the latter are rarely used now. What we tend to forget, and what my worthy opponents have tried to disprove, is that technology is, after all, just a tool made by humans for humans. Without the clinical acumen of a professional, this tool cannot be used. And this is one of the biggest reasons that technology does not blunt clinical acumen, because the knowledge to use it at the right time and the right place for the right patient still lies in the hands and competence of a clinician. Now let's address the elephant in the room, artificial intelligence. AI has threatened to make doctors obsolete ever since it was just a concept. But what we realized after putting it into use, that AI works well and good as long as it has been fed data. But when a new variation crops up, like we saw during COVID, it is not as reliable. We still need to rely on clinicians only. And even when used as a diagnostic tool, it can present reports in an unbiased manner, meaning a benign condition or a serious complication, both the patient will see in a monotone. This is where clinicians' role starts. Tackling new challenges and guiding patients toward treatment plans ensures that clinicians are never removed from the equation of treating a patient. The 21st century is the era of evidence-based medicine. And it is well accepted that clinical experience is a pillar of this evidence-based medicine. This drive towards objectivity in medicine is complemented by the standardization of test results provided by technology. And it even prevents overdiagnosing in some cases. Hence, we find that technology supplements clinical reasoning. It does not replace it. In 2020, the whole world came to a standstill. While the healthcare industry grappled with the pandemic, the number of patients in other emergency and non-emergency care were also increasing. In such unprecedented times, remote patient monitoring came to the rescue, where indeed COVID challenged the clinical acumen of doctors like never before. When the doctors only had the verbal history given by a patient over, let's say, a video call and just their vitals, and they still had to manage the patients, then how can we say that the clinical acumen has blunted? Because as we see in this example, technology only acts as a vessel for clinicians to practice their art. In fact, not just COVID, technology has benefited in the quicker diagnosis of other infectious diseases as well. Earlier, a diagnosis of TB that was based on strong clinical suspicion would take 6 to 8 weeks for confirmation, a crucial amount of time wasted for the patient. Now, even a minor clinical suspicion of a case can be confirmed rapidly with GeneXpert. Thus, our patient care has also improved vastly. Looking forward into the future of medicine, it is my humble opinion that not only will technology make us better clinicians, it will make us better thinkers too. The scope that various advancements provide instill a sense of clinical curiosity amongst doctors today. Today, doctors are sharing their unique and atypical findings worldwide for other clinicians and students to refer to. Today, we are using groundbreaking technology like CRISPR gene editing for diseases like sickle cell anemia. My point is, we're doing all of this today. Tomorrow, a clinician using his acumen, who knows what more they can think of in the terms of applications of the technologies we have today. The world is evolving, and so must medicine along with it. But before I close my debate, I would like to offer a word of caution as well. Technology does not see bioethics or socioeconomic status. It is ethics neutral. Hence, we must set down proper guidelines to ensure that overuse of technology does not blunt our clinical acumen and that healthcare remains affordable and accessible. Thank you.
Okay, thank you so much. We'd like to conclude our debate here. I'd like to thank all our judges for their time and input. Please, can we have a round of
We are
applause
still
for them?
here. We are still here. Just don't thank right away.
Acha, just go for it.
Still
हाँ
here.
जी, हाँ. Take your time, please. हाँ जी. हाँ. हाँ, please.
I would कुछ comment दे दूं sir पहले before. Sir, topic was technology has blunted our clinical acumen. The topic was not that the technology has blunted medical health care. 90% of you talked about medical health care or healthcare system and technology. No, that was not the topic. What I am wondering, what Dr. Prashant questioned you initially was, has clinical acumen gone? You are not being taught or you don't know what it is? This is the take home message I am taking today after this debate. So I would request you all to become ambassador of making clinical acumen aware. What is clinical acumen and what a physician, because tomorrow you all are going to be physicians, you should know what is clinical acumen. For example, there is a sound or a music coming from outside. आप बता दोगे jazz है, ये है, वो है. That is musical acumen. Similarly, if you have a patient in front of you and you examine the patient, a clinical acumen will tell what are the signs and symptoms. So that is clinical acumen. We are not talking about the whole medical healthcare system and technology. The topic was very focused and only one or two of you could focus on that topic. Rest all were diffused. You talked everything, every technology about. Nobody talked about point of care systems. Nobody talked about bedside technology. I'm quite amazed that this generation is so. Very recently, I went to a school where 9th and 10th class student participated in a debate. I am sorry to say that they were better than you. I'm really sorry. And we are being represented by all medical colleges. It is not just one or two medical colleges. All medical colleges of Delhi, and today NEET says that Delhi is number one in country. Majority, 67% people in top 100 have picked up Delhi. So are we getting this quality of students in medicine? I am really not very happy with it.
I think they are used between medical practice and medical acumen. That's why they could not differentiate between the two. So medical acumen is different than technology, your medical practice. So you should stress upon medical acumen more than medical practice.
Our medical acumen is our own sense, which we develop over the years. When you go to the college, first time in the ward, you have been taught how to take history. That gives you the acumen. From there, you start getting everything. We can never deny the techniques. The newer techniques will always be there. They will enhance our further progress. But now what I am feeling is that we will become just an empathical person with the AI around. AI will do the rest of the work and we'll just touch the patient and we'll say, okay, you're all right. We don't want that type of a doctor. We are human. We will always treat human beings. Whatever the instruments come, they will be operated by us only. So our acumen is not being taken away by them. Our acumen has been enhanced by them. It has not been taken away. And probably you have understood it that way, that it has been taken away from your acumen. It is not like that. Probably, because you are young students and probably you are unable to get the crux of the topic.
Prashant. Yeah, Prashant.
fortunately or unfortunately, you medical students are growing in an era where technology is definitely taking us ahead, and AI is, of course, threatening us. But the topic is very apt for your generation because you are medical students. You should not worry about technology or discuss. Technology is definitely there. It is going to help us. There is no two opinions about it. But the point is, developing a clinical acumen at this stage is the most important. Like even in a medical exam, MBBS exam or MD exam, the examiner doesn't ask you, what investigation you will do. That comes the last. And you are not assessed on the basis of that, whether you are ordering right investigations or not. You are being assessed on the basis of how much, whether you missed the murmur or not, whether you missed chest findings or not, whether you missed liver palpation properly or not. So basically, clinical acumen is something which is most important at this stage. Otherwise, as some people were talking that technology and AI, definitely we have passed that generation, but you are going to face the threat of AI if we place the clinical acumen with technology. So be aware, develop the clinical acumen, develop the human element, develop the human empathy. That will never replace, and in all good textbooks of medicine it is written, medicine is still an art, it is not only a science.
I'm Dr. Harmeet. I am not a part of the jury, but I was here. So one thing I would like to tell you all of you that many congratulations to all of you because I was here and I was hearing all of you. You are best leaders. Because it is not easy to stand there and talk about and debate because so seniors are there and the comments that you are getting from your seniors, take it in a positive way. Inbuild yourself and teach yourself and teach your colleagues and take in a positive way and become the leaders in healthcare sector. Thank you.
Sir, cash prize तो सबको नहीं दे सकते। हाँ?
wonderful to witness that small line of generation gap. I'll take the side of the younger generation for a change. Soon, in 50 years, it has been predicted, there is a concept of singularity, where binary mind will become one, the machine and the man. And it's not too far. And immortality is not a dream. Immortality is also going to come in another 200 years. But who wants to live? The question will be, who wants to live that long? And where's the doctor? Everything will be self-healing. So, the generation here is the future. And you have to be prepared for that also. That is my message. Thank you.
So now I'd like to thank our judges again by a felicitation ceremony. At the moment, I request all the participants to please stay back and stay for the rest of the evening because we have a very special evening planned for all of you and other guests that will be arriving. Right now we have a high tea facility. Please go and join that, and followed by our flag hoisting ceremony. Right? Please come to it. And judges ka felicitation bhi done. Results will be announced later. And there is a cash prize for the winners, so please stay back.